Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuy.com. This is 25 practice NCLEX questions. Without the way, let's get started.
Amoxicillin trihydrate 300 milligrams PO has been prescribed for a client with an oral infection. The medication is available in a liquid suspension that is available as 250 milligrams per 5 milliliters. How many milliliters should the nurse administer? Blank ml. The correct answer is 6 milliliters. The formula is 300 milligrams over X ml equal to 250 milligrams over 5 milliliters. You cross multiply and get 250X equals to 1500. You divide by 250 on both sides and you get 6 milliliters. A client is admitted to the hospital after vomiting bright red blood and is diagnosed with a bleeding duodenal ulcer. The client develops a sudden, sharp pain in the mid-epigastric region, along with a rigid, board-like abdomen. The nurse should do which of the following first? 1. Administer pain medication as prescribed. 2. Raise the head of the bed. 3. Prepare to insert a nasogastric tube. 4. Notify the physician. The correct answer is 4. The client is experiencing a perforation of the ulcer, and the nurse should notify the physician immediately. The body reacts to perforation of an ulcer by immobilizing the area as much as possible. This results in board-like abdominal rigidity, usually with extreme pain. Perforation is a medical emergency requiring immediate surgical intervention because peritonitis develops quickly after perforation. Administering pain medication is not the first action, although the nurse later should institute measures to relieve pain. Elevating the head of the bed will not minimize the perforation. A nasogastric tube may be used following surgery. A client is to take 1 daily dose of ranitidine at home to treat a peptic ulcer. The client understands proper drug administration of ranitidine when the client will take the drug at which of the following times? 1. Before meals. 2. With meals. 3. At bedtime. 4. When pain occurs. The correct answer is 3. Ranitidine blocks secretion of hydrochloric acid. Clients who take only 1 daily dose of ranitidine are usually advised to take it at bedtime to inhibit nocturnal secretion of acid. Clients who take the drug twice a day are advised to take in the morning and at bedtime. It is not necessary to take the drug before meals. The client should take the drug regularly, not just when pain occurs. A client who is recovering from gastric surgery is receiving IV fluids to be infused at 100 milliliters per hour. The IV tubing delivers 15 drops per milliliter. The nurse should infuse the solution at a flow rate of how many drops per minute to ensure that the client receives 100 milliliters per hour? Blank drops per minute. The correct answer is 25 drops per minute. To administer IV fluids at 100 milliliters per hour using tubing that has a drip factor of 15 drops per milliliter, the nurse should use the following formula. 100 milliliters over 60 minutes multiplied by 15 drops over 1 milliliter, which equals to 25 drops per minute. A nasogastric tube inserted during surgery to correct an infant's intussusception is no longer freely removing gastric secretions. Which of the following should the nurse do next? 1. Aspirate the tube with a syringe. 2. Irrigate the tube with distilled water. 3. Increase the level of suction. 4. Rotate the tube. The correct answer is 1. The first action is to check the placement of the tube to ensure that it is in the correct position. To check tube position, the nurse should aspirate the tube with a syringe. A return of gastric contents indicates that the end of the tube is in the stomach. Another method is to inject a small amount of air while auscultating with a stethoscope over the epigastric area. The tube is irrigated with normal saline, not distilled water, and only after the position of the tube is confirmed. The suction level should not be increased, because doing so could damage the mucosa. Rotating the tube could irritate or traumatize the nasal mucosa. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. An infant diagnosed with Hirschsprung's disease is scheduled to receive a temporary colostomy. When initially discussing the diagnosis and treatment with the parents, which of the following would be most appropriate? 1. Assessing the adequacy of their coping skills. 2. Reassuring them that their child will be fine. 3. Encouraging them to ask questions. 4. Giving them printed material on the procedure. The correct answer is 3. By encouraging parents to ask questions during information sharing sessions, the nurse can clarify misconceptions and determine the parent's understanding of information. A better understanding of what is happening allows the parents to feel some control over the situation. Assessing the adequacy of the parents' coping skills is important, but secondary to encouraging them to express their concerns. The questions they ask and their interactions with the nurse may provide clues to the adequacy of their coping skills. The nurse should never give false reassurance to parents. At this point, there is no way for the nurse to know whether the child will be fine. Written materials are appropriate for augmenting the nurse's verbal communication. However, these are secondary to encouraging questions. A child is admitted with a tentative diagnosis of Shigella. The nurse should do which of the following? Select all that apply. 1. Assess the child for nausea and vomiting. 2. Collect a stool specimen for white blood cells. 3. Place the child on airborne precautions. 4. Monitor the child for signs and symptoms of dehydration. 5. Initiate an intake and output record. The correct answers are 1, 2, 4, and 5. Shigella is caused by the Shigella organism. Clinical manifestations of Shigella include fever, nausea, and vomiting, some cramping, headache, seizures, rectal prolapse, and loose, watery stools containing pus, mucus, and blood. The nurse should assess the child for these symptoms on an ongoing basis. Shigella is spread via direct contact with the organism, which is found in the stool. A stool specimen will show increased numbers of WBCs, blood, and mucus. Vomiting and loose stools can result in severe dehydration and electrolyte imbalance. Thus, the nurse should record intake, output, and daily weights. There is no need for strict isolation. Masks are not needed, as Shigella is not transmitted by airborne methods. A 9-month-old is admitted because of dehydration. How should the nurse go about accurately monitoring fluid intake and output? Select all that apply. 1. Weighing and recording all wet diapers. 2. Change breastfeedings to bottle feedings. 3. Obtaining an accurate daily weight. 4. Restricting fluids prior to weighing the child. 5. Obtaining an accurate stool count. The correct answers are 1, 3, and 5. Accurate intake and output recording includes noting all intake, including IV fluids, noting output, such as emesis and stool, weighing diapers, measuring weight daily, measuring urine-specific gravity, monitoring serum electrolytes, and monitoring for signs of dehydration. Children who are dehydrated must receive sufficient fluid intake, but having a breastfeeding child switch to bottle feeding will not promote intake. Restricting fluids just prior to weighing the child will not alter the accuracy of the weight, and the nurse should continue to encourage fluids for this dehydrated child. A multigravida in active labor is 7 centimeters dilated. The fetal heart rate baseline is 130 beats per minute with moderate variability. The client begins to have variable decelerations to 100 to 110 beats per minute. What should the nurse do next? 1. Perform a vaginal examination. 2. Notify the primary healthcare provider of the decelerations. 3. Reposition the client and continue to evaluate the tracing. 4. Administer oxygen via mask at 2 liters per minute. The correct answer is 3. The cause of variable decelerations is cord compression, which may be relieved by moving the client to one side or another. If the client is already on the left side, changing the client to the right side is appropriate. Performing a vaginal examination will let the nurse know how far dilated the client is, but will not relieve the cord compression. If the decelerations are not relieved by position changes, oxygen should be initiated, but the rate should be 8 to 10 liters per minute. Notifying the primary healthcare provider should occur if turning the client and administering oxygen do not relieve the decelerations. Which of the following would the nurse expect as a common finding for a multiparous client giving birth to a viable neonate at 41 weeks gestation with the aid of a vacuum extractor? 1. Caput succedaneum. 2. Cephalohematoma. 3. Maternal lacerations. 4. Neonatal intracranial hemorrhage. The correct answer is 1. Caput succedaneum is common after the use of a vacuum extractor to assist the client's expulsion efforts. This edema may persist up to 7 days. Vacuum extraction is not associated with cephalohematoma. Maternal lacerations may occur, but they are more common when forceps are used. Neonatal intracranial hemorrhage is a risk with both vacuum extraction and forceps births, but it is not a common finding. A client is admitted at 30 weeks gestation with contractions every 3 minutes. Her cervix is 1 to 2 centimeters dilated and 75% effaced. Following a 4 grams bolus dose, IV magnesium sulfate is infusing at 2 grams per hour. How will the nurse know the medication is having the intended effect? 1. Contractions will increase in frequency, leading to birth. 2. The client will maintain a respiratory rate greater than 12 breaths per minute. 3. Contractions will decrease in frequency, intensity, and duration. 4. The client will maintain blood pressure readings of 120/80. The correct answer is 3. The expected outcome of magnesium sulfate administration is suppression of the contractions because the client is in preterm labor. Magnesium sulfate is a smooth muscle relaxant used to slow and stop contractions. Having contractions that lead to birth is not the intended effect of this drug when used for preterm labor. Respirations lower than 12 breaths per minute may indicate magnesium sulfate toxicity. Another use of magnesium sulfate is to treat preeclampsia by preventing seizures and, secondarily, lowering maternal blood pressure. However, in this scenario, preterm labor, not preeclampsia, is being treated. As a nurse begins her shift on the obstetrical unit, there are several new admissions. The client with which of the following conditions would be a candidate for induction? 1. Preeclampsia. 2. Active herpes. 3. Face presentation. 4. Fetus with late decelerations. The correct answer is 1. The client with preeclampsia would be a candidate for the induction process because ending the pregnancy is the only way to cure preeclampsia. A client with active herpes would be a candidate for a cesarean section to prevent the fetus from contracting the virus while passing to the birth canal. The woman with a face presentation will not be able to give birth vaginally due to the extended position of the neck. The client whose fetus exhibits late decelerations without oxytocin would be at greater risk for fetal distress with use of this drug. Late decelerations indicate the fetus does not have enough placental reserves to remain oxygenated during the entire contraction. This client may require a cesarean section. During a home visit to an elderly client with mild dementia, the client's daughter reports that she has one major problem with her mother. She says, "She sleeps most of the day and is up most of the night. I can't get a decent night's sleep anymore." Which suggestions should the nurse make to the daughter? Select all that apply. 1. Ask the client's primary healthcare provider for a strong sleep medicine. 2. Establish a set routine for rising, hygiene, meals, short rest periods, and bedtime. 3. Engage the client in simple, brief exercises or a short walk when she gets drowsy during the day. 4. Promote relaxation before bedtime with a warm bath or relaxing music. 5. Have the daughter encourage the use of caffeinated beverages during the day to keep her mother awake. The correct answers are 2, 3, and 4. A set routine and brief exercises help decrease daytime sleeping. Decreasing caffeine and fluids and promoting relaxation at bedtime promote nighttime sleeping. A strong sleep medicine for an elderly client is contraindicated due to changes in metabolism, increased adverse effects, and the risk of falls. Using caffeinated beverages may stimulate metabolism, but can also have long-lasting adverse effects and may prevent sleep at bedtime. When developing a plan of care for a client with Alzheimer's disease who is experiencing moderate impairment, which of the following types of care should the nurse expect to include? 1. Prompting and guiding activities of daily living. 2. Managing a medication schedule. 3. Constant supervision and total care. 4. Supervision of risky activities, such as shaving. The correct answer is 1. Considerable assistance is associated with moderate impairment when the client cannot make decisions but can follow directions. Managing medications is needed even in mild impairment. Constant care is needed in the terminal phase when the client cannot follow directions. Supervision of shaving is appropriate with mild impairment. That is, when the client still has motor function but lacks judgment about safety issues. An elderly client who has been diagnosed with delusional disorder for many years is exhibiting early symptoms of dementia. His daughter lives with him to help him manage daily activities, and he attends a daycare program for seniors during the week while she works. A nurse at the daycare center hears him say, "If my neighbor puts up a fence, I'll blow him away. He has never respected my property line, and I've had it." Which of the following actions should the nurse take? 1. Observe the client more closely, but do not report his threat, since he will likely not be able to follow through with it because of his dementia. 2. Report the comment to the client's daughter, so she can observe him more closely, but refrain from telling the neighbor due to privacy regulations. 3. Report the comment to the neighbor, the intended victim, but refrain from telling the daughter since she will just worry about actions of her father she cannot control. 4. Report the comment to the neighbor, the daughter, and the police since there is a potential for a criminal act. The correct answer is 4. The neighbor could be harmed as well as the daughter if she should try to stop her father, so both should be notified. The nurse has a legal/ethical responsibility to warn potential victims and other involved parties, as well as law enforcement authorities, when one person makes a threat against another person. This duty supersedes confidentiality statutes. Failure to do so and to document it can result in civil penalties. The client's early dementia would likely not prevent him from carrying through his threat. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. During the assessment of a client's mouth, the nurse notes the absence of saliva. The client reports having pain behind the ear. The client has been nothing by mouth for several days, but now can have liquids. Based on these findings, the nurse should do which of the following? 1. Request a prescription for an antifungal mouthwash. 2. Instruct the client to brush the gums as well as the teeth. 3. Encourage the client to suck on hard candy. 4. Give the client a hydrogen peroxide-based mouthwash. The correct answer is 3. The lack of saliva, pain near the area of the ear, and the prolonged NPO status of the client are indications that the client may be developing parotitis or inflammation of the parotid gland. Parotitis usually develops with dehydration combined with poor oral hygiene, or when clients have been NPO for an extended period. Preventive measures include the use of sugarless hard candy or gum to stimulate saliva production, adequate hydration, and frequent mouth care. The client does not have indications of stomatitis, which produces excessive salivation and a sore mouth. The client does not have indications of oral candidiasis, which causes bluish-white mouth lesions, and a nurse does not need to request a prescription for an antifungal mouthwash. There are no indications that the client has gingivitis, which can be recognized by the inflamed gingiva and bleeding that occur during toothbrushing, and while the client should brush the teeth and gums, increasing salivation to prevent parotitis is a priority at this time. When obtaining a nursing history from a client with a suspected gastric ulcer, which signs and symptoms should the nurse assess? Select all that apply. 1. Epigastric pain at night. 2. Relief of epigastric pain after eating. 3. Vomiting. 4. Weight loss. 5. Melena. The correct answers are 3, 4, and 5. Vomiting and weight loss are common with gastric ulcers. The client may also have blood in the stools from gastric bleeding. Clients with a gastric ulcer are most likely to have a burning epigastric pain that occurs about 1 hour after eating. Eating frequently aggravates the pain. Clients with duodenal ulcers are more likely to have pain that occurs during the night and is frequently relieved by eating. A client has been taking aluminum hydroxide 30 milliliters 6 times per day at home to treat a peptic ulcer. The client has been unable to have a bowel movement for 3 days. Based on this information, the nurse would determine that which of the following is the most likely cause of the client's constipation. 1. The client has not been including enough fiber in the diet. 2. The client needs to increase the daily exercise. 3. The client is experiencing an adverse effect of the aluminum hydroxide. 4. The client has developed a gastrointestinal obstruction. The correct answer is 3. It is most likely that the client is experiencing an adverse effect of the antacid. Antacids, aluminum salt products, such as aluminum hydroxide, form insoluble salts in the body. These precipitate and accumulate in the intestines, causing constipation. Increasing dietary fiber intake or daily exercise may be a beneficial lifestyle change for the client, but is not likely to relieve the constipation caused by the aluminum hydroxide. Constipation, in isolation from other symptoms, is not a sign of a bowel obstruction. Following a gastrectomy, the nurse should position the client in which of the following positions? 1. Prone. 2. Supine. 3. Low Fowlers. 4. Right or left Sims. The correct answer is 3. A client who has had abdominal surgery is best placed in a low Fowler's position postoperatively. This positioning relaxes abdominal muscles and provides for maximum respiratory and cardiovascular function. The prone, supine, or Sims position would not be tolerated by a client who has had abdominal surgery, nor do those positions support respiratory or cardiovascular functioning. Which of the following assessments should be the priority for an infant who has had surgery to correct an intussusception and is now at risk for development of a paralytic ileus postoperatively? 1. Measurement of urine specific gravity. 2. Auscultation of bowel sounds. 3. Inspection of the first stool passed. 4. Measurement of gastric output. The correct answer is 2. Development of a paralytic ileus postoperatively is a functional obstruction of the bowel. Bowel sounds initially may be hyperactive, but then they diminish and cease. Measurement of urine specific gravity provides information about fluid and electrolyte status. The first stool and the amount of gastric output provide information about the return of gastric function. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. After teaching the parents of an infant diagnosed with Hirschsprung's disease, the nurse determines that the parents understand a diagnosis when the father states which of the following? 1. There is no rectal opening for stool to pass. 2. There's a tube between the trachea and esophagus. 3. The nerves at the end of the large colon are missing. 4. The muscle below the stomach is too tight. The correct answer is 3. The primary defect in Hirschsprung's disease is an absence of autonomic parasympathetic ganglion cells in the distal portion of the colon. Thus, the nerves at the end of the large colon are missing. Absence of a rectal opening refers to an imperforate anus. A tube between the trachea and esophagus refers to a tracheoesophageal fistula. Presence of a tight muscle below the stomach refers to pyloric stenosis. Which of the following will most likely alert the nurse to the possibility that a preschooler is experiencing moderate dehydration? 1. Deep, rapid respirations. 2. Diaphoresis. 3. Absence of tear formation. 4. Decreased urine specific gravity. The correct answer is 3. The absence of tears is typically found when moderate dehydration is observed as the body attempts to conserve fluids. Other typical findings associated with moderate dehydration include a dry mouth, sunken eyes, poor skin turgor, and an increased pulse rate. Deep, rapid respirations are associated with severe dehydration. Decreased perspiration, not diaphoresis, would be seen with moderate dehydration. The specific gravity of urine increases with decreased output in the presence of dehydration. The primary care provider prescribes intravenous fluid replacement therapy with potassium chloride to be added for a child with severe gastroenteritis. Before adding the potassium chloride to the intravenous fluid, which of the following assessments will be most important? 1. Ability to void. 2. Passage of stool today. 3. Baseline electrocardiogram. 4. Serum calcium level. The correct answer is 1. Potassium chloride is readily excreted in the urine. Before adding potassium chloride to the IV fluid, the nurse should ascertain whether the child can void. If not, potassium chloride may build up in the serum and cause hyperkalemia. An electrocardiogram could be done during intravenous potassium replacement therapy to evaluate for these changes. Having a stool daily is important, but because potassium is primarily excreted in the urine, the child's ability to void must be verified. Serum calcium levels do not indicate the child's ability to tolerate potassium replacement. A nurse is preparing a change of shift report and has been caring for a multigravida client with a normally progressing labor. Which of the following information should be part of this report? Select all that apply. 1. Interpretation of the fetal monitor strip. 2. Analgesia or anesthesia being used. 3. Anticipated method of birth control. 4. Amount of vaginal bleeding or discharge. 5. Support persons with the client. 6. Prior birth history. The correct answers are 1, 2, 4, 5, and 6. Knowledge of how the fetus is tolerating contractions, as well as the frequency, intensity, and duration of contractions, as indicated on the fetal monitor strip, are extremely important. The type of analgesia or anesthesia being used, the client's response, and her pain rating should be included as well. The amount of vaginal bleeding indicates whether this labor is in the normal range. Vaginal discharge indicates if membranes are ruptured in the color, odor, and amount of amniotic fluid. The support persons with the client are an integral part of the labor process and greatly influence how she manages labor emotionally and, commonly, physically. A complete change of shift report will include the client's name, age, gravida and parity, current and prior illnesses that may influence this hospitalization, prior labor and birth history if applicable, last vaginal examination time and findings, vaginal bleeding, support persons with client, current IVs and other medications being used, and pertinent laboratory test results. Future plan for birth control would be the least important information to be given to the next shift because it will not impact the labor care plan. 2 hours ago, a multigravida client was admitted in active labor with her cervix dilated at 5 centimeters and completely effaced and the fetus at 0 station. Currently, the client is experiencing nausea and vomiting, a slight chill with perspiration beads on her lip, and extreme irritability. The nurse should first 1. Warm the temperature of the room by a few degrees. 2. Increase the rate of intravenous fluid administration. 3. Obtain a prescription for an intramuscular antiemetic medication. 4. Assess the client's cervical dilation and station. The correct answer is 4. The nurse should assess the client's cervical dilation and station because the client's symptoms are indicative of the transition phase of labor. Multiparous clients can proceed 5 to 9 centimeters per hour during the active phase of labor. Warming the temperature of the room is not helpful because the client will soon be ready to begin expulsive pushing. Increasing the intravenous fluid rate is not warranted unless the client is experiencing dehydration. Administration of an antiemetic at this point in labor is not warranted and may result in neonatal depression should a rapid birth occur. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.